Hello, and welcome to the Skyemont Health Driver Medical Series. In this series, we explain common medical issues that can delay, restrict, or lead to an unsuccessful professional driver medical. Today, we are looking at epilepsy and seizures, and what they can mean for a Group 2 lorry, bus, or coach license. We will cover what to do after a seizure, the difference between established epilepsy, an isolated seizure and a provoked seizure, and the evidence that may be needed before a licensing decision is made. First, the safety rule. If you have a seizure, blackout, fit, or an unexplained loss of awareness, stop driving and tell the relevant licensing authority. In Northern Ireland, that is the DVA. Seek medical advice straight away. Not every event is treated in the same way. The licensing authority will consider whether there is established epilepsy, a first unprovoked or isolated seizure, or a seizure with a clear provoking cause. The risk of another event is central to the decision. For an established epilepsy history, the Group 2 standard is very strict. Licensing may only be considered after 10 years without any seizure and without medication to treat epilepsy during those 10 years, with no continuing increased risk. A first unprovoked or isolated seizure has a different benchmark. Group 2 licensing may be considered after 5 years without another seizure and without seizure medication during that period. A recent neurologist assessment is normally needed, and the predicted annual risk of another seizure must be no more than 2%. A provoked seizure is assessed separately. The cause must be clearly identifiable and reliably avoidable. Group 2 driving may need to stop for up to 5 years, depending on the cause, any underlying brain condition and specialist evidence. These cases are individual. Anti-seizure medication matters, but never stop it just to try to meet a licensing standard. Stopping suddenly can be dangerous and can cause further seizures. Any change should only happen under the clinician responsible for your treatment. For your medical, bring your DLM1, D4, taxi or employer form, photo ID, your current medication list, the date of your most recent seizure or blackout, and recent GP, neurology, or hospital letters. EEG, scan, or discharge information can also help prevent delays. The driver medical records the relevant history. It does not guarantee the license. The DVA, or other licensing authority, makes the final decision, sometimes after getting specialist evidence. If you are due a medical, book early and gather your paperwork before the appointment. If this video helped, please like, share and subscribe for more clear driver medical guidance from Skyemont Health.